Hello and welcome to PandemiCast. We are excited to bring to you something different this episode. Episode 15 will be split into two parts where we rope in perspectives from our associates across Africa on the impact of COVID-19 in the region. But while you wait, here are some highlights of what's to come.
And thank you very much. Today we have Sharon Kuntai with us, who is a communications and project specialist with Hyderus Teoranta based in Nairobi, Kenya.
We're very lucky to be able to welcome Averty Ndzoyi, who is the founder of Espace Opoko in the Republic of the Congo.
Dr. Morenike Folayan, who is a professor with the Obafemi Olowu University in Nigeria. Sharif Bujan, very nice to have you. Sharif is a freelance journalist and president of the Gambia Press Union.
And we're joined by one of our Baird CMC shareholders and one of our most well-established partners within Baird CMC, Angel Kwemo.
Very lovely to have Ms. Thandeka Nkiwane on the call with us. Thandeka is an international affairs specialist and an associate of Baird CMC.
Welcome the chairman, the co-chairman of Baird CMC, Francois Baird. We're joined by another of our colleagues, Simba Makoni.
We've seen, especially here in Kenya, Matsidisho, I don't know if you know or if it's the same in your country, but most people in my country have been in denial. Most people have been saying that this infection, this disease is not there. Most people have been saying that it's a lie.
The more cases you have, this is African say, the more cases you have, the more support you have from the international community. They try to inflame the numbers so they can get more support. So you don't know which one to believe.
You think there are countries that may be inflating the numbers to gain international support, as well as countries that may be suppressing the numbers so as not to scare visitors, tourists, investors?
Who knows? You know, in Africa, what is possible is not possible, and what is impossible is very possible. Who knows?
If things were out of hand, we definitely would have known that things are out of hand. It's not just the fact that there's no testing or your figure says now. It definitely isn't out of hand. So whatever you're doing seems to be going a long way, though we do acknowledge that there's still gaps in what you're doing.
The difficulty we have here in Zim is you really don't know the reality. What most of us believe is we know very little of what is happening.
At the beginning, I think the media, both to the public broadcaster as well as independent media, gave the government a lot of the benefit of the doubt in terms of numbers. Increasingly, I think there's been a lot more interrogation of the substance, and I think it's a healthy situation.
There are a lot of conspiracy theorists in this country, people talking about COVID is not in the Gambia. There's a lot of people who doubt the messaging of the government wasn't as effective as it should, because then we've seen that in terms of dissemination of COVID information, the government agencies, they relaxed their methods, and we've seen that efforts too were reduced. And then it reached climax when our vice president and at least 3 ministers tested positive for COVID. Then people started getting nervous, people started getting scared and asking questions. What happened? What must have happened?
The media in Congo is government controlled. We have a lot of bad information in social media, because in social media, everyone can write and send every information you want. So it is very difficult. And now we can see that many people in Congo don't trust that the coronavirus exists.
The problem had been from the social media, not the traditional.
In short, the government have lost the information war because leaders lack the credibility to speak truth to the people.
It's painful that the people of Zimbabwe are not able to work together, even on a matter like COVID-19 or food security and food relief, because of the polarization in our politics. And that percolates literally every sphere of our pursuit.
But as it is happening in the Gambia now with COVID, it coincides with the peak period for people who have malaria. People with malaria are scared to go to hospital because they will be tested for COVID. Those who are willing to go to hospital, they cannot access hospital because most of the hospitals, their services have been reduced to, not more than half.
I can say that the pandemic has affected most people greatly, especially people with NCDs who are high risk.
Non-COVID-19 hospital beds are relatively empty. And that has been a big problem. And we can see that it's a crisis that is going to affect the country and affect the region very, very severely.
Not specifically about health, but international cooperation on multiple fronts being a key weapon against the pandemic. How do you see that progressing? I mean, the world is almost frozen by COVID, and it's so difficult to see progress being made on any other front.
The issue with trade at the moment is that the old system is broken and a new system is not yet in place. And I don't think there's enough leadership in the world today to create a new system that is firstly opening up the world for growth again through trade, and secondly, creating a system that's more equitable to small markets and small players.
Robust responses are going to have to be at the small business level. They're going to have to be at the informal sector level. There's not going to necessarily have to be in the short term a robust formal sector response. But in terms of particular issues, I think that, again, we're going to be forced by circumstances to have to react.
I think the idea of collective action and collaboration is wonderful. I think in practice, it's not going to happen for a long time.
One of the challenges we have when we speak about even Africa, yes, there's Africa, the continent, but I think when it comes to collaboration, we should also be looking at regional collaboration.
This whole thing about what we need to do stands against the background of what is happening. And what is happening is that none of the comorbidities of Africa has gone away. The corruption, absolute incompetence. So Africans have a double comorbidity. They have to live with their own diseases as well as the continent's diseases and the government's diseases. And I don't see collaboration at all being possible in any meaningful way for the benefit of the people. There might be collaboration to steal, but there's not going to be collaboration to help people. It will be tokenist. It will be words instead of doing. How do we solve that problem?
What do they say? The perfect is the enemy of the good. And that's where I'm at right now in terms of our approach. We have to realize that in this imperfect situation, what gains on the margins can we make in addressing these serious issues?